So yeah, in case it wasn't obvious, tonight we are talking about the critical nursing shortage and why it is totally screwing everybody over. And why it's the system's fault and the system that we as healthcare providers have created, and why it's our, like, how we've totally screwed this whole situation up. Part of it is active, part of it's just passivity, and, you know, allowing this broken system to exist and digging the hole deeper. We are very bad at putting down the shovel. Let's first talk about what's going on at my hospital. Things have really come to a head with Omicron. We have, as the title of this stream would suggest, a critical nursing shortage. We are currently basically shutting down the OR to everything that is not an urgent or emergent surgery or procedure. That's the gist of it. So our normal volume is 30 to 35 cases. Today we did 10 in the operating room. The operating room is what makes hospitals money. That's where they make all of their cash. Well, I say all of their cash. The vast majority of their cash. It is the most efficient money earner for hospitals everywhere. So when you start cutting down on the OR, that's really serious, because that's the revenue stream, basically. So that's the last thing to go when things are in dire straits. And we are, like, slashing it, right? So, like, we're cutting the OR by 2/3. You know, huge deal. This is a huge deal. And the reason we're doing it is not because the hospital is overwhelmed. The reason we're doing it is because there are no nurses. There aren't nurses to take care of patients. So we have been in the situation where we're not doing any elective procedures that require hospital stays. So that means, like, back surgeries, total joint replacements, hysterectomies, things like that are generally very, like, safe, quick surgeries, but they have people stay overnight. We eliminated those probably 3 weeks ago, 2-3 weeks ago. And now it's just anything that is even remotely elective is done. We're not doing it. Our surgery center's shut down. We have no elective procedures at all going on. So there is a ton of money that's not coming into the hospital because we don't have any nurses to take care of them. We don't have nurses in pre-op, in the post-op area. We don't have nurses on the floor. And the floor is what you call, yeah, it is totally brutal. Totally brutal. The floor is what you call, like, general inpatient area. The ICU itself is overwhelmed. Bringing the chiropractor's problem solved. Yeah, totally. So, like, the rest of the hospital is not, but the ICU is overwhelmed with COVID patients. Backtracking a little bit, we've talked about this. Like, so Omicron itself, like, on an individual basis, is not as dangerous as any of the other strains that we've seen. As compared with Delta, you're about 70% less likely to be hospitalized. But because it's so contagious and we have so many freaking cases, like, for reference, before Omicron hit, the record for cases diagnosed in a day, COVID cases diagnosed in a day, was like 300,000-ish. Right now, the 7-day rolling average is 800,000 cases. So over 7 days, we have averaged 3 times the previous maximum. Okay, that's how fucking crazy Omicron is. All right, so even though it's not, like, on an individual basis as dangerous as Delta, we still have more people coming into the hospital, like, just because so many people are getting it. But yeah, so how long will this keep going on for? We don't know. Like I said, if you look at the numbers from South Africa and from London, which kind of dealt with the Omicron variant before we did, there's basically, like, a 3-week run-up to the peak and a 3-week, like, you know, degradation back to normal. So we're probably in for another 2-ish weeks, 2 to 3 weeks, maybe, something like that. But we don't know. We don't know for sure. The ICU itself is kind of overrun, but the rest of the hospital really isn't. It's just a nursing shortage. So what we are doing, like I said, is cutting down the OR time, not admitting as many patients to the hospital. You know, we're transferring the people that we can. And our recovery area, the PACU, which is post-anesthesia care unit, is being converted to an ICU. It's technically it's ICU level care, but those people only stay there for like an hour or two, you know, tops. So the nurses who are in our pre-op and PACU areas are getting this, like, crash course in, you know, sort of longitudinal critical care, because they're used to just, like, stabilizing people and shipping them off to the ICU if they need to go there. And that's fine. I mean, there's nothing wrong with that. That's their job. That's what they're supposed to do. But now they're going to be tasked with taking care of all these people who are just going to like be chilling, for days. And that's a very different game. But they're getting, like a 2-hour education course on this and just like expected to do well. And, similarly, like we as anesthesiologists are expected to take care of these people. And while that's something that we have extensive training in, it's not something that we're like super used to, and like we don't understand the culture of the hospital. We don't have all the connections for like transferring these people if necessary, or like downgrading their care once they improve. And like all of that sort of stuff is very foreign to us, basically. Like we're just not in tune with how that goes. So there's a lot of logistical problems there. Like we can take care of these people in a safe and appropriate way, but as far as making their stay efficient and moving them along in some sort of like meaningful fashion, that's something we just don't do very often. Your travel nurses are being paid a lot more, and as much as attendings. Yeah, absolutely. Yeah, so the travel nurses being paid really well, huge problem. Herein lies the problem. So one of the points that you will see in that Dr. K video, should you watch it, is that basically all frontline workers are underpaid. And this is something that I've professed for a long, long, long time. There's lots of professions that are just like ludicrously underpaid. Teachers, cops, firefighters, nurses. Those are probably the 4 that come to mind most readily to me. And what a lot of people seem to not understand, and by people I mean administrators, is that if you put more money into these people, you get better candidates. And this is not a problem that'll solve itself immediately, but over 10 years, 15 years, 20 years, you'll see a change where more people who are highly qualified and highly motivated will go into these professions. In Kansas, there are only 3 new science teachers in this entire state. I totally believe that. Why would you be a teacher, right? What's your motivation, dude? A lot of the teachers at your high school are talking about that. Yeah, but what's your motivation? Why would you be a teacher? You make shit for money. You're in like a hopeless situation right now. Your kids are constantly being tested for COVID. Like, do you teach remotely? Do you teach in your classroom? Do you do both? Like, how do you make lesson plans? There's just an unbelievable amount of work that goes into this. And this kind of like plays into the whole nursing thing, right? So these people who are like essential frontline workers are just getting shit on, and they're not making the money to compensate for that. And a lot of these things are totally uncompensated. Like, I mean, they're doing tons of work at home outside of the workplace, and that's just like to keep up with stuff. That's just to function, and there's no compensation for that at all. They're just expected to do that as part of their job. And that's like, why would you do that? Why would you get paid for 40 hours of work when you're working 90? That's totally unacceptable. Yeah, teachers and police way underpaid, in my opinion, absolutely. Like, I'm going to do my best to keep this as unpolitical, as apolitical as possible. But this is the problem that we're having, and this is being really unroofed by the pandemic, right? The difference between nurses and the other professions we listed, teachers, cops, firefighters, is that nurses have an option, right? Nurses have an out. So we've seen that, a lot of other sort of frontline workers, like fast food workers, people making minimum wage, are getting higher wages. And, in my opinion, that started with COVID relief programs. Like, why would these people go to work for, normal work weeks, 40+ hour work weeks, when they could make 80% of that or equal to that by doing nothing and just getting unemployment benefits? Like, what's the motivation? Why would they do that? I mean, I wouldn't do that. If I were in that position, I'd be like, I could work this whole week, or I could sit at home and do whatever the hell I want for the same amount of time and make the same amount of money. And so that has really spurred a baseline pay increase, right? Yeah, everybody is that underpaid. That's the thing, is like everybody's just sort of like let this go. It's been the case for a long time. I mean, minimum wage has been the same for like 20 years. But cost of living is increased by 3% per year. All of these people are making $8 an hour, and there's no way you can pay your rent on that. And so they were like, you know what, fuck this. I'm not going to go to work. I'm going to take this government subsidy and hang out. Like, yeah, it's not a lot of money, but like, why work for that money if you can sit at home and get it? Like, I totally don't blame them. But yeah, so we ran into this huge wall of people who are just like, well, screw it. I'm not going to get into the workforce. Why would I do that? Why would I bother? But like I said, nurses are the ones who have an option out of this, and that is travel nursing. Because all of a sudden, since everybody needed healthcare, basically all healthcare positions were in massive demand. So nurses are leaving to do travel nursing. And travel nursing, for those of you who don't know, is like literally twice as lucrative as having a full-time position as a nurse, sometimes more than that. Off the top of my head, do not know exactly what an hourly rate for a nurse is, but say it's somewhere in the $30 to $35-ish range. If anybody knows different, please correct me and let me know. But travel nurses can make $70 to $100 an hour. So like, it's potentially possible that you literally make 3 times as much money. Hospitals just aren't keeping up with it. Like, why would you stay working at $30 an hour when you can go somewhere else, especially if you're like young and single, which is a lot of nurses are. You know, if you, and even if you're not, like, if you're literally going to triple your income, why would you not do that? And that's what we're running into. So there's tons of nurses who are quitting to go travel nurse because it just makes sense. Like, why would you not do that? Like, yeah, you've got to pay for your healthcare. Yeah, you pay more taxes because you're a 1099 employee, but so? If you're making 300% as much money, like, that doesn't fucking matter, you know? Like, you're making so much more cash that all of those extra expenses, like paying for your own benefits, it doesn't matter. It doesn't matter. And hospitals are not keeping pace with that. Nurses are just in such massive shortage that hospitals are willing to pay whatever it takes to get people because they have no choice. You know, or they do what happened at my hospital and they shut down the operating room. They get into a death spiral where they don't have enough people to even support the thing that's making them money. And that's where they're really screwed. So again, like I said, hospitals are not keeping pace with that income potential at all. And you know, like any other business, even if they're not for profit, hospitals are for profit, right? Like they're all about making money. And so for years and years and years, decades even, they've been about the bottom line, and they've tried to, you know, squeeze their nurses, squeeze everybody, but squeeze nurses in particular. And nurses are just so underpaid, and that fact is really bearing itself out right now, where they have options, right? They can go somewhere else and make 3 times as much money. So, you know, when hospitals are like, well, instead of $30 an hour, we'll pay you $45, and nurses are like, screw you, I'm gonna go make 80. Like, why would I take that? Why would I take your increased money? Yeah, nurses are getting banged. Everybody's getting banged because we're exposing the system that has failed them and failed us for so long. Like I said, the hospital's like kind of trying to offer them this pittance to stay, but that's just not going to work, man. It's not going to work. Like, people value stability and, you know, benefits and long-term commitments, but dude, like, you can't be paying them half of what they can get elsewhere. So yeah, nurses are leaving because hospitals haven't shown them that they are important enough to keep. And, you know, okay, so you have to pay them twice what you historically paid them. So, you know, if you don't pay them that, they're going somewhere else. They're gonna quit. They're gonna leave. And they are leaving. They're leaving in mass. Again, nurses have no incentive to keep working the way that they are. And they're massively overworked. And like they were massively overworked before. Nurses get abused constantly. Like, there's this weird culture in healthcare where it's just like okay to treat people like shit for some reason. Like, you know, you can yell at your doctor or your nurse or something, and that's just like okay because you're the patient. Like, that's great. And nurses take that all the time. They take like sexual assault and abuse, and that's just like part of the job, you know, because you have to you know, make sure that the patient's satisfied and, you know, like, make the hospital look good. And it's totally unacceptable. And they've just had to deal with that. Like, administration doesn't have their back at all. I mean, there's just like so much nurses have to deal with. And, you know, you get the pay, you get the like bad working conditions, you get the overwork, and they're just not taking it anymore. They see an opportunity and they've flown the coop, and rightfully so. I totally support that decision. They're in such high demand that they can fix that problem, and they're choosing to do so, as they should. Because we've created this situation where You know, it's okay for them to be abused in every sense, like by the people they're working for, by their employers, by the people they work around. Like a lot of nurses take a ton of shit from doctors and, you know, even other like nurse practitioners and stuff. Other practitioners, they're just ground into dust all the time, and it's terrible. And if like I said at the very beginning, if you pay them better, you will get better nursing candidates too. It won't be this giant chasm of income or quality of life between being a nurse or being a doctor or being a nurse practitioner. Like, you wouldn't have all of the qualified, like, you know, good nurses basically wanting to do an advanced degree, because they'd be like, well, shit, I make 6 figures, so, you know, whatever, I don't need 2 more years of education. This is fine. This is a good job. You know, I'm not getting spit on by my patient, or not getting my ass slapped constantly. I'm not getting yelled at by a doctor. Like, I have so many stories about nurses just getting treated like absolute shit. Like, my wife's a nurse, and she told me, like, it's an amusing story, but it's very, like, illustrative, you know, it tells the story. Like, when she was, she worked at a private heart hospital, and that was, like, physician run. And she worked nights for the first, 2-3 years of her career. And she called, like, when she was kind of new at this hospital, she called a physician about something. I don't know, about, like, some order or whatever. That physician, like, came in from home, drove to the hospital to yell at her. Like, to get in her face and yell at her about calling him in the middle of the night. And that's the culture that we've fostered. You know, it's not just the patients. It's the doctors, it's all the people who are around. I mean, and we've allowed that to be okay for literally decades. I mean, it's insanity. And nobody would take that. Like, can you imagine what would happen if you did that at, like, I don't know, like, Google? Like, if you literally drove into work to yell at somebody who called you at Google, what do you think would happen? You'd probably have a lawsuit against you, right? You would get fired. You'd have a lawsuit against you. And probably with good reason. But in medicine, that's just normal. Another story, when I was a first-year med student, one of my best friends from med school and I, who was a girl, for the record, we went to we had to do a complete history and physical on patients. So we went to the VA, and because that was, like, where we were assigned to, and like, just basically chose some patient on, you know, some inpatient list to go talk to. And, you know, it meant nothing, and he was, like, a basically healthy dude. But on the way to him, you know, she was a, like, pretty attractive girl, like, you know, tall, skinny, lanky. On the way up to this dude's room, she got her ass slapped 3 times. And that's what, and, you know, nursing is predominantly a female-driven profession, and that's what they deal with in hospitals. Like, that's what women have to endure. And it's bullshit. They should not have to do that. But they do. It's just part of the job, and if you complain about it, you're like a bad seed. You know, so there's so many factors at play here. Yeah, it's so screwed up. So screwed up. And again, now that they have options, they're taking them, and they're getting out of those situations. And it, like I said, it is all our fault. We've allowed that to happen. We've allowed this toxic culture and, you know, toxic work environment to fester for years and years. And now hospitals are paying the price. Hate being a woman. Yeah, you should not be a piece of meat, right? Like, you're a highly educated, trained professional.
Yes.
And it's unacceptable that you are treated as anything but that in whatever environment you're in. But like I said, we've allowed that to be acceptable, and even like protected people who behave that way. Yeah, so now that nurses are in such ridiculous demand that they can do whatever they want, they're doing it. And so hospitals are suffering, and they're having to pay for it. So instead of just, like, shelling out the cash in the first place like they should have, now they're having to both shell out the cash and suffer the consequences of not having done it in the past. You know, like, they're, like, in my case, they're shutting down the operating room. You know, they're shutting down wards. They're taking this massive financial hit because they were penny wise, pound foolish. They can't stay closed forever? No, they won't. Like, they will get a substantial amount of staff back once people recover from Omicron, you know, so within, like, 2 weeks, probably. Like, this sort of situation will mostly resolve, but they're going to have tons of people who have still quit, and so there will still be a shortage, and they're going to have to do what they should have done a long time ago, which is pay people what they're worth. Yeah, it's just a shame, man. It's sad that it's come to this point, but I am, in a sense, I'm sort of glad that this has happened, because now maybe, like, again, maybe things will change. You know, maybe nurses will get paid more. Maybe we'll get higher quality nurses, and like all of the good nurses won't just immediately go to practitioner jobs. Where's the money coming from? Oh, hospitals are so like they're in such good shape financially. It's just unreal. there's no problem there. Yeah, it's healthcare is an enormously profitable enterprise. If you pay your people more now, like, yeah, it sucks. It hurts the bottom line immediately, but then you don't have to pay travelers 20% more than that. You know, like if you suck it up and you pay your nurses $60 an hour, then you don't have to pay the agency plus the agency nurse $100 an hour. And you keep people that you have, you build chemistry, you know, you make your working environment better, which improves productivity, and like, you know, on and on and on. Like, this is a smart investment on the part of the hospitals, because now they're fucked, right? Like they don't have their main source of revenue, which is the operating room. And they also are paying people way more than they should have, or should have to, because they didn't pay the people that they had in the first place. Like, they tried to skimp on, you know, antiquated salaries, and, you know, now they're screwed. Now they're hosed, because all those people left. Paying to orient new employees? Oh, yeah, absolutely. Like, training people is extremely expensive. I mean, you have to pay, like, straight up pay to orient them, right? Like, nursing orientation is 6 months. 6 months. So you, like, they're basically cleaners, and you're paying somebody to, like, kind of work, you know, at minimal capacity for 6 months. Plus you got to pay them signing bonuses. Plus you have to pay them more money anyway, because they will just go somewhere else if you don't. Yeah, I just wonder how long it's going to take to fix this problem, and if it's actually becoming apparent that some sort of massive, like, overarching systemic change is necessary. For those of you who do not know me, I am Milkman Al. I am usually on Wednesdays and Sundays, 8 to 10 p.m. Central, so please don't forget to follow and or subscribe if you like. Come out and hang with us. It's a good time all the time. Have a good night, guys. Again, appreciate you coming out. Take it easy, y'all.